tell them anything you want, and sometimes I even show them, because it's a very difficult test to do. So, you know what, you're going to have to work with someone when you do a test that speaks a person's language, so they can translate. That's, absolutely, absolutely.
It's hard to have them good because they run out of breath and they get tired.
Yes.
That's all they're in.
And so the American Thoracic Society, they set the standards for spirometry. Is when you do a spirometer test, what you're trying to do is, first of all, what is this test measuring? Does anybody know?
Or
okay.
have more,
Like if you can just double check. Thank you.
Okay. Okay, yes, this will help you uncover issues. This actually measures volume capacity of the lungs. If I were to take up a balloon and blow it up and show you this volume capacity, that's exactly what spirometry is doing. Those small alveoli that make up our lungs have a lot of surface area, and when they're not inflamed, their capacity is large. They have a large surface area, so large volume. When they're inflamed and things are going wrong with them, with inflammation, that size reduces. So this is going to measure the size of our capacity of our lungs, and it will give an indication that something's wrong. And further tests would be done. There's lots of other tests that would be done. So when you understand the reason for the test, then you're going to try to help the person comply the best they can. In the example you gave where someone's really sick, really can hardly blow, it's just going to measure what they can do at that moment in time. But the ATS says, look, we want to do a couple tests and we want them to be close. In other words, it's reproducible. Because if I take a blood sample from you, send it to one lab and send it to another lab, and the results come back, different, which one do you trust? You have to redo the test because you can't determine which one's right. So you have to do the same thing. So the lab results should typically come back almost identical, even if they're sent to different labs. So spirometry, they're saying, hey, we want those tests because it's a hard test to do. A lot of people don't understand what they're doing, and it's literally been called a communication test. So in a chance where language is an issue, it's really a challenge. Mm-hmm. So you're going to work with the person.
Yeah.
Make sense?
Yeah. We did a few times.
Okay. All right. So now shifting gears, do we have our Zoom going?
Yeah.
Okay.
Thank you.
All right. So let's go ahead and let's complete all the information that's important. Of course, the patient's name, date of birth, gender, and I believe, do you use an ID number for patients? An ID number?
We have it. We don't write that.
If it's not required, then that would only be required if your office requires it. Okay. So once you get all your information in, you hit start exam. Ooh. So start exam. So she clicks start exam down here. Oops. Let's go ahead and turn this on. I just pushed this button right here. Oop. We may need to pair it, and we can do that real quick. Click on this icon up here, this little wheel, and hit WAM pairing. And hit start.
The WAM receiver is not available.
The WAM receiver. Does this have Bluetooth in it? And has it been paired? Oh, here it is. Okay. We need this in it. Trying to put that in there. Maybe upside down. There you go. I'll try that one. I think, yeah, that's it. Should be it. There we go. Okay. There we go. So now let me transfer it around. All right, we have a simulation right now. So this is the pairing. This has to be put in. You just saw one that needs to be put in over. So this is communicating with this. All right, so here we have our waveforms. Once it's gone through, if you hit ECG, it'll show you your ECG, and if you like your ECG, you can then hit print. If this is connected to a computer or a printer, you'd walk to that printer and you'd be done. And that's all there is to it.
So technically that just went to the printer now?
Yes. All right. So let's see how that worked out. So, oh, and when you put these on the skin, make sure they're flat like this, like that. Like that will cause a problem.
It connects to the right track.
I don't even know what printer it's supposed to be connected to.
I'm sure that's something Ali can
Yeah.
certainly help you with. That's a minor issue.
See, it just says it's not giving me a printer.
Yeah, that's,
Okay, we'll have.
yeah, that's something that. So again, if you don't like it, you can hit the trash can. And then it's just discard it. Are you sure you want to? Yep. Now we're back to here again. You can hit ECG again. Take a good one.
So you have like several patients back to back. Once you're done with one patient, how do you get that?
To the main screen. Okay. So once we're done, so what do we want to do at this time? Do we want to save this? Do we want to just delete it? You've printed it. What do you want to do at this point?
That's really up to the provider.
Yeah. So let's just save it. Just hit the save icon there. So it's saved. And so here we are back at the start. We would clear, hit exit. You double click it. There you go. And then just click on ECG again. And the file to the right, if you wanted to look up patients that you've saved, that's where you could look them up. Like it shows you a regular Manila file. Just like
So it saves directly on the software.
but it's saved on here. And if you wanted to connect it, you'd have to work with, Ali would have to work with your IT or your company. Does that make sense? Why don't you try another one? Who's your second favorite? Oh, yeah, let's have someone else do it. Let's find out what your favorite cartoon character is. And if you hit tab, it takes you to the next field.
Powerpuff Girls.
Oh, there you go. Powder puff. Girl power.
Hi, Jake. This is Ali Sadi. So just to be clear, this computer has the setting.
Yep, you need age, the birth, yep. Then gender.
So we need to hire me.
Right, and then hit start exam. Well, if you put in height and weight, it really is good because, you know, again, a person who is a little heavier, that's going to tell that information going to a provider is going to give them much more information when they look at the ECG. Absolutely. So let's go ahead and turn this on. So I was just telling everybody, make sure that these are flat, not like this. I think you stepped out flat because
Yeah.
this it won't work that way.
Right.
And these tabs actually bite into the electrode. There's little teeth in it, believe it or not. Now they've really actually made some nice improvements with the connectivity.
Okay, do I start with the ECG?
Yep, hit the ECG. And there you have it.
Okay.
There it is. And then you hit print.
So when we attach that to the body, we hit ECG after we attach.
Yes, and I always start with connecting them first.
Okay.
You may ask the question why. Ask why.
Why?
I'm glad you asked that question.
But I don't think that's connected to the printer.
I insist on having fun while training because it keeps you guys interested. In
Okay, now, say there's an issue with
Wait, I just
one.
asked him why.
Oh, why what?
I was trying to get out of the question.
Why do we have to turn on, like you said, turn it on before?
Because what happens is the warmth of the body activates that gel and it gets real good adhesion to the skin. So the longer that adhesion is on the skin, that it gets warmed up and it gets it actually kind of melds into the skin better and gets better connectivity, reducing artifact. So hooking them up first with the electrodes is important because they're laying there, you know, and they're getting those electrodes warm.
Mhm.
And typically it's cold. They're always cold, you know.
Not in this place.
So turn on first and then.
Well,
stick-
I would actually just get them all prepped because you're
Prepped.
using, you know, the warm
Yeah.
2x2 with water. You're getting them all prepped and you're getting all the electrodes on. And then they're laying there, but you've got everything nice and flat. You've got the wires, so they're not, because when wires are like, you know, twisted, they want to flip off.
Mhm.
So you want to make sure they're nice and flat.
Okay.
And once you get that done, then come here and enter the patient information. Turn it on, enter the patient information. So that's, any other questions on EKG?
Okay, now, say one of the leads isn't connected properly or whatever, will it give us the,
Yes. You pull off V6.
That says fail.
Yep, V6 failed. And I'm sorry, you've used up all your questions. You can't have any more.
Yeah.
I don't want that. So, I wanna know.
Honestly, you can ask, I love it when people ask lots of questions because it means they have things they want.
Okay,
answers to,
now,
so I'm always happy.
Okay, so you're saying to store the
Yes,
pads in a Ziploc bag?
yes, they actually have the pouches right here. There it is. This actually has a zip lock
Okay,
built into it.
now, would it be better just to use this or literally put them in another Ziploc bag?
This, if you seal this, this works great. This is
Okay.
a foil pouch. This works great.
All right.
This works great. So what I say is open it up, take your one out, seal it back up. And that way it's done. You don't have to touch it again. You got all you need to do your test right here.
So we order these right through Henry Schein.
Is that who you like to
Yeah.
use? Yes. Yes. Is
Please.
that Eric Anderson?
Yeah.
Yeah, Eric, order through Eric, absolutely. So that's the EKG.